Hi, and thank you so much for taking the time to review my application for the Ortho Innovators Award. My name is Dr. Grant Coleman, and I'm an orthodontist in Charlotte, North Carolina in private practice, and my invention is the Isoglide Eruption Spring. Briefly about myself, I went to college at the University of Alabama and then dental school at the University of Alabama School of Dentistry in Birmingham. And then I did my orthodontic training at Virginia Commonwealth University in Richmond, Virginia, where I got a certificate in orthodontics and a Master of Science degree. So jumping right into my topic here, impactions are an extremely common occurrence in orthodontics, and specifically, one of the most common is the maxillary canine. And incidence of maxillary canine impaction has been shown to be about 1 to 3% of the population. Here's an image that we commonly see in the practice of ortho. Upper right canine impacting, tipped toward the palate, although they can be in almost any position, mid-alveolar or buccal. But this tooth is extremely important for both looks and function, and we have to deal with it not doing what it's supposed to all the time. And sometimes we have to go after impacted teeth to help bring them into the arch. Currently, the most common method of dealing with impacted teeth is to refer the patient to a periodontist or oral surgeon, and then they begin what is termed the gold chain method of bringing in this tooth. And you can see in this image here that a gold chain is bonded to the impacted tooth and then tied to the orthodontic arch wire, and then typically force is applied to that chain by tying the chain to the wire with an elastomeric thread or elastic chain, and that thread then puts pressure on the tooth through the gold chain to help guide it into position into the arch. There are many negatives associated with this gold chain method of addressing impacted teeth. First, for the patient, the process is inconvenient because it requires multiple appointments to reactivate the elastomeric thread that's attached to the gold chain. That thread only applies force for a couple of weeks or so before the force actually decreases rapidly and then goes to zero. So the patient has to go back multiple times, typically every 2 to 3 weeks, to have it reactivated. Every time that thread or chain is retied, there's increased discomfort for the patient because there's typically a very high force associated with those elastomerics, so it hurts. And then lastly, those extremely high forces that are applied by the elastomeric thread or chain has risks associated with it, including the risk of bone necrosis, undermining resorption, and possibly root resorption of the affected tooth. There are multiple negatives for the orthodontist as well when using this gold chain method. As mentioned, multiple reactivation appointments are required. The patient has to keep returning to the office every 2 to 3 weeks to reactivate the elastomeric, and that just eats up chair time. So that causes clinical inefficiency. There's an increased number of visits and then decreased revenue per visit for the orthodontist. And then ultimately, the net profitability for the orthodontist for that case goes down because there is a fixed cost every time we seat a patient in the chair. The take-home word for the current gold chain method of addressing impactions is that it is just inefficient for both the patient and the orthodontist. So in 2008, I was working on a patient in my private practice, and I was retying a gold chain and getting really frustrated with it. And I just said to myself, there's got to be a better way to do this. So I began making prototypes in office and using those on my own impaction patients with the help of the local periodontist that I work with. And we tested that appliance and made revisions to it over the course of several years till we had good data to support that we had a good device. So once I knew I had a viable device and a viable idea, in 2014, I applied for a US patent. And then in 2018, I was granted my first US patent on this device in November of last year, and then in October of this year, 2019, I was granted a second patent for this device as well. So looking at the actual design of the Isoglide Eruption Spring, it consists of a orthodontic bonding pad on one end, and on the other end there's a stainless steel clamp that will be attached to the orthodontic arch wire, and those two ends are connected by a nickel titanium coil spring that can stretch up to about 25-26 millimeters without deformation. You can see here in this picture when the spring is placed correctly, the bonding pad is bonded to the impacted tooth and then stretched to the arch wire, and then slowly over the course of the next several weeks, that spring will want to collapse back to its original length, and as it does so, it slowly and gently brings the impacted tooth with it until it is erupted. There are several benefits to using the Isoglide Eruption Spring. First, for the patient, fewer appointments are needed because the appliance, when it's placed correctly, does not need to be reactivated. So there, right off the top, multiple appointments are saved for the patient. There's less discomfort because if you're not having to reactivate the appliance, you're not reintroducing those very high forces. And in addition to that, because it's a light constant force, that's what moves teeth the best. And so the tooth moves faster and typically is erupted in a matter of only 6 to 12 weeks as a comparison to frequently 6 to 9 months with the gold chain method. And that leads to less total time in braces for the patient. The orthodontist gets to enjoy many benefits as well. First, again, fewer appointments needed to finish the case. And we mentioned that it's a faster process, typically 6 to 12 weeks for eruption, so treatment time is reduced. That leads to decreased overhead and cost per visit for the orthodontist, and overall increased profitability for the case because they're treating it more efficiently in less time with fewer appointments. And lastly, and very importantly, we've got happier patients, happier moms and dads because they are spending less time in the orthodontist's office and getting out of braces faster. I made this device available for sale online in May of this year, and the response has just been tremendous. It's been so fun to see people from the United States and Canada and Europe and as far away as New Zealand ordering this device because they are so excited about the potential of doing something that is better and faster and more efficient than the old way of doing it. And it's been great to get pictures like these from practitioners all across the country sending me their photos showing what they're using it to do and how much it's benefiting both them and their patients. And that's why I invented this. I really wanted to make this as a benefit to the orthodontic community, not just for us as the doctors, but really for our patients to be able to save them time and discomfort and just make the whole process of saving these impacted teeth that much easier. Thank you so much for considering my application. I really appreciate it. And if I can be of any help or answer any questions, please feel free to reach out and contact me. Thank you so much.